So, addressing health and healthcare disparities requires infrastructure for quality measurement and improvement, right? Well, the more accurate the information gathered, the better the decisions made and the better the results that can be achieved. Local health facilities in Isiolo County are now making use of an app to take stock of the entire supply chain for family planning services, a provision in the health system that has for a long time appeared to be a foreign concept. The use of the app is expected to yield results away from the manual reporting that continues to be used in most parts of the country.
We live in a world of change, disruption and innovation, and how we deliver healthcare services is rapidly changing. And while that requires investment, the health fraternity here in Isiolo County knows too well what it means to the residents of Isiolo in matters health service delivery, especially in the delivery of family planning services. Kenya's family planning program has been considered successful as the country surpassed its 2020 target of 61% modern contraceptive prevalence rate for married women to a current regional high of 62%. A few years back, the prevalence was only 36%. However, some counties like Isiolo and Kilifi are struggling at the lower end of the curve, where rapid growth for family planning utilization is possible.
The data quality is a challenge. Timeliness of the data was also a challenge. And the issue of either commodity management in terms of either stock out or overstocking.
Ordinarily, health facilities have been submitting such booklets or commodity reports to the sub-county headquarters monthly. The reports provide details of average monthly consumption and the stock at hand of the given facility and their various programs, which could include HIV and AIDS, malaria and tuberculosis.
Fika hapa again, I start keying one by one to the reporting page, which is DHIS.
So you have to take the reports to the main records office by 5th. So you'd find a situation whereby you're not able to see patients for a number of days, maybe 1 or 2 days, so that you can finish up with the reports.
For Peter Ngugi, who is the head pharmacist at the Isiolo County Referral Hospital and whose duty is to compile these reports that come from at least 18 different facilities to Kenya's integrated health system to avert any stock out of medicines, the manual reporting is always a hindrance.
So Oldonyiro is a facility in the border of Laikipia and Isiolo sub-county. During this current season, which is the rainy season, for someone to leave from Laikipia to Isiolo, they have to go all the way to Nanyuki first, then connect to Isiolo. So that's around 200 kilometers of travel.
That in addition to accommodation and upkeep expenses for the medical officer bringing the report. Given the challenges and the state of family planning in the county, the county's health ministry opted to undertake a pilot program that will see them improve their data collection with regard to family planning.
HealthStart provided us with tablets, that is for all healthcare facilities in the county. If I click on a facility, for example, this one is a CK facility, I can see their report.
The app known as Qualifam is linked directly to DHIS, Kenya's health information system.
Because of real-time reporting, we can spot where we have overstock, take it to the facility we don't have stocks, and the facility where I think the consumption is low, we can see what is the root cause for the low consumption and all that, and see there to adjust.
Especially for the stocks, you had to store something called a control card that you have to keep on updating. So in case it's misplaced, unless you do the physical count again, so that you're able to know where you are at that moment. But right now, you just have to check it online. And yeah, it's efficient, it's easier.
Network challenges, however, come into play, with the county government promising to sustain the project given its benefits. Despite that, however, socio-cultural and religious challenges still hinder the uptake of family planning services in the county.
Kwa sababu ndio basi sisi onekana ukidara kwa mkono hivi. Kisha unasema mimi mgonjwa naenda hospitali, unaenda unaweka tena kingine. Ukikuja nyumbani mwanaume tu anakaa, ikifika mwisho anasema kwani shida yako lakini nini? Mbona hata usai? Na ngoja mtoto nimechoka.
For example, in Islam, men don't strongly believe that there is need for family planning because children are coming from God and you should give birth as much as you can.
According to the county health executive member, Wario Galma, resources have also been channeled to tackle maternal mortality in the county, which stands at 790 per every 100,000 women.
Men involvement is a key issue and it's being addressed. It's a gap. Let's say it's a gap, but it's being addressed. Because until men get fully involved, then it becomes a challenge because family planning involves two people.
So far, the app is being used for family planning services across 6 counties: Homa Bay, Kilifi, Marsabit, Nairobi, Migori and Isiolo, with plans to roll it out to other health programs and other counties come January 2021. Raquel Migai, Citizen TV.